Okay, so good morning and welcome to the conference, dear colleagues. It's such a pleasure to be with you this morning. And in the true spirit of this presentation, I'm with you virtually. I'm very sorry that I can't be with you in person and see your smiles and see your eyes and look and exchange the dialogue with you. Nevertheless, I hope that in the next few minutes of sharing, this will be thought-provoking and something that may even offer you an action for the future. How to talk about digital health. And I believe that we're all very familiar what digital health is about. Nevertheless, it's worth looking at what are the things that sometimes are in front of our eyes, but we are perhaps not paying them enough attention. And just a brief word of introduction about myself. I'm a director of WHO, or World Health Organization Collaborating Center for Digital Health and Health Education at the joint medical school between Imperial College and NTU in Singapore. It's called LKC Medicine. I'm also director of Center for Population Health Sciences, but above all, a physician scientist. So let us begin. I will talk about a very big topic, and as such, it's meant to give some thoughts and some pointers rather than cover it comprehensively. And perhaps even a little bit engage, who knows, maybe even entertain you. So why care about digital health education? I will talk a bit about latest developments in our work, make some suggestions where this could become your work, next steps, and what impact this could have. And finally, if time permits, we will play with the words digital health education with emphasis on digital health education. And the two are really working hand in hand with each other. Digital health does not need an introduction. Yet, as a very new and dynamic field, there are over 90 different definitions of digital health. What does this mean when a field has so many different definitions? More than anything, that it is vibrant, that it is young, and that there is an enormous pace, breadth, diversity to it. And that is the best reflection of what digital health really is. I will not read out the definitions of FDA or HIMSS, but what we can see from those is that the way that digital health is positioning itself, that it's really touching every aspect of medicine, whether that is your communication with patients, data capture, decision support, or any other area such as education. They all have opportunity and are already being, in so many ways, transformed by digital technologies. And that is so exciting. I want to start and tell you that just before the pandemic was to start, there was a report by Eric Topol about the need to prepare healthcare workforce to deliver the digital future. What a foresight. A few months later, the pandemic started, and we saw an enormous, truly enormous digital transformation. Things that we could not imagine happening in decades have happened overnight, in days. And many of those technologies, which were in this report predicted to be started to be introduced in 2025, 2030, or much later, suddenly became very, very mainstream part of medicine, whether this is telemedicine, whether it's smartphone apps, or many others. So we could say that implementation went ahead of robust evidence. And what does this mean for us today? Really, more than anything, not so much that we should backtrack and move the pendulum back away from digital, but rather that where we went digital, we should aim, besides the pragmatic evidence, to support it with robust, rigorous evidence to ensure sustained quality and safety of that healthcare that we are now delivering through digital technologies. But let's look at, are we really ready for this? And besides we look at that, just one more report, and this one is by Stanford. And it's really recognition that there is a rise of what we can call data-driven physician, where the physician of today, and not just tomorrow, is not only informed or supported by data, by AI, by machine learning, but is really increasingly augmented and perhaps in some areas replaced. Don't worry, there is such a shortage of physicians. There is no risk that those replacement areas are of any danger to us. So let's now look at what does the future health workforce, medical students, think about readiness for this digital transformation. And this is such a nice study of medical students across Europe and beyond, which explored students' interest, readiness for the digital health technology's promise to improve patient outcomes, to transform health systems delivery and quality safety experiences of care. Worryingly, what those students reported is that more than half felt that their digital health skills were poor or very poor. So here you go. When I share this with some of the deans of different medical schools, they said, but they are Y, Z generation. Do we really need to teach them how to use digital technologies? And my response to this is, do we teach the smartest and the brightest who we accept into medical schools how to talk? And yes, we do. We teach them communication, consultation skills. And no modern medical school can imagine a curriculum without a strong emphasis on communication, consultation skills. Yet those people know how to speak and talk. So why are we teaching them? And that is really the answer to, do we need to teach them digital health skills? I could give you other reasons other than just those students' perceptions that they are ill-prepared for using the modern technologies, electronic health records, computer decision support, e-prescribing, as they enter medical practice. Just a little bit about our work in related areas. And one is digital health, and the other is digital health education. Whatever we are doing in terms of digital transformation should be based on robust evidence. It should be evidence-based. We've conducted tens of large systematic reviews, informed guidelines, written policy reports on the topics. And let me give you one example around mobile or M-learning for health professions. This informed the WHO guidelines and recommendations for digital information for health system strengthening. There were other reports and work that really is contributing to formation of how the future of medicine should look in terms of digital education, in terms of digital health education. So there's one piece of work that, as the pandemic was unfolding, we wrote a guideline or a guide for how to conduct remote consultations. And this has been downloaded by more than 300,000 physicians or 300,000 times and has become verbatim NICE guideline, so National Institute for Clinical Excellence, which is not just used in the UK, but many European countries and globally. And what this showed really, and was translated also in several languages, Spanish, Portuguese, Italian, and so on. But what this really showed is how the health system, as the need is there, is ready to transform almost overnight. And that we are seeking that best possible evidence, and we are pragmatic. Let me look now at this challenge from a health systems perspective and think about health economy. You may know that in many health systems around the world, the largest part of healthcare expenditure is not on expensive hospitals or surgical theaters or medications, but on something else. And that is salaries, salaries of healthcare professionals, doctors, nurses, pharmacists, and all others. Why does this matter? Well, if 50, 60, or even 70% of expenditure, of all of our expenditure on healthcare goes for salaries, goes for health workforce, then that should really bring into focus even more than even the smallest changes in competencies of that health workforce, not just how hard they work, we all work very hard, but in their competencies can have transformative impact in so many other ways than just patient outcomes. Yet, countries around the world are facing a challenge to develop and maintain those competencies as the health care is rapidly changing. The shortage of those skills, inadequate learning methods, and limited access to learning, and diverse training needs and target groups that require really tailored training experiences. How do we rise to this challenge? And that is challenge of today, not tomorrow. First, in terms of vision, it's to see, and we could say a renaissance or revisiting of our focus on really equipping everyone with the best competencies, with the best knowledge, skills, attitudes in this rapidly changing context to achieve the UN goal of health for all. Secondly, our mission has to be to build, develop, enhance skills. And in terms of objectives, this really means training millions of both patients as well as healthcare professionals. Enhance health and digital health literacy of both players, healthcare professionals and patients. And finally, to blend the on-site, in-person, and digital state-of-the-art learning delivery of healthcare. So let's go back to our digital health competencies and how you could make a difference in your area, in your medical school, perhaps in your specialty or your training. If digital health is not yet part of the formal training, here is an invitation, not just to go through these questions and ask, what is the scope? What should the syllabus look like? Or which competencies should it aim to develop in students? And so on. But join the effort that we are leading with Andrzej, who is in the audience, with colleagues across the Digital Health Systems Collaborative. And please contact me, reach out to us as we are developing the expert consensus, international expert consensus, and we can share not just the latest evidence, but best practices and experiences with each other. We started with literature review, and what this really told us is that in terms of existing frameworks, the field is moving on. We need new and we need dynamic approaches. We need frameworks which respond to new technologies, which are becoming mainstream, such as AI, such as robotics, virtual reality, metaverse. And in terms of different professions and patients and carers, we all need to play part. On a very foundational level, we want to improve knowledge, skills, and attitudes as they relate to particular clinical or preclinical setting, and seamlessly integrate this with teaching of other courses. So let me give you an example. As we teach cardiology, we can teach about use of wearables to recognize AI atrial fibrillation, about digital stethoscope. As we teach about diabetes or endocrinology, there is an opportunity to strengthen digital health competencies and skills, which are essential for understanding how AI is used in insulin pumps, which are autonomous systems. And if you may think for a moment, I can leave this to others, then let me ask you whether you would leave to others decision-making about your patient's best possible outcomes. And I'm sure that that's not something you can delegate to others. What we found is that even when digital health is being taught, it's often being assessed on a paper or in the formats which do not follow the new technologies. So here's an opportunity for learning analytics, for education data science, and transformations in so many ways of how we do digital and how we do digital education. We strongly believe, on the basis of needs and impact on clinical care and healthcare, is that digital health needs to be, one, integrated seamlessly in teaching of different parts or components, building blocks of medicine. Secondly, it should be mandatory and comprehensive, and longitudinal with explicit learning objectives, and with assessment of a range of outcomes, evaluated and dynamic to introduce and reflect the dynamism of digital transformation of our world, such as questions around trust in AI. how far can we trust AI? And when can we trust AI? And when we should be not just skeptical, but not use it. Now, I said that we will also briefly try to cover digital health education. And I have just one slide on this. And that is the conceptual framework for how digital health education could be thought about. And what are the building blocks, the components. This is a published work in the leading digital health journal, JMAR. And I will not go through all those aspects, but invite you, as you are considering how to have or how to strengthen the digital education or digital health education, to reflect whether all those building blocks are already part of your system, whether they are strong, whether they are seamlessly integrated, and whether the learners and you as teachers have fun as you leverage the digital for the better future. Thank you.